Okay, I'm in frame. Look good?
Yep, recording.
All right. Hi, my name is Stacy Brock. I am a registered nurse here at Carteret Healthcare. I am also the orthopedic clinical coordinator. And today we are going to go over your pre-op hip class. This is something that's important to us and extremely beneficial for our patients. The goal today is to go over all things hip, starting from how to prepare at home, what to anticipate while you're here at the hospital, and then what to do to care for yourself when you get home. The overall goal of everything is basically to keep you safe because that's the most important thing. So today we are going to start with the most important thing, which are going to be your hip precautions. All of our surgeons here do a posterior approach. That means that your incision for your hip replacement is actually more back here towards your rear end than it is here in the front. This is the tried and true gold standard when it comes to a replacement. The only downside is that you are going to have some precautions in place which limit your mobility. The last thing we want for you to do is have a hip dislocation or a complication. So let's start by talking about how you are sitting in the chair. Most patients will say that they have a hard time sleeping in bed, they're really uncomfortable sitting on a couch, or they're just having difficulty getting up and down. So let's look at how you should be sitting. When your feet are flat on the ground, your shoulders are over your hips, this is your nice neutral position. This is where your body is the most comfortable. As you can see, and I'm going to turn my chair right now, you tend to create a 90-degree angle, which is what we want, okay? I do recommend highly that everybody have a recliner, an ottoman, somewhere to prop their feet up on when they're home. We are going to just use this little table right now so that you can see angles. When I put my feet up and I'm sitting in the chair, I'm still creating that nice 90-degree angle. If you want to lean back, just like this, still nice big angle, which is what we want. This is what we want to avoid, bending forward. So hip precaution number one, do not break that 90-degree angle by leaning forward. So patients will say, well, Stacy, how do I manage? That's life. That's right. That is life. Getting dressed, going to the bathroom, feeding your pets, daily activities like you drop something on the floor. So you will be visited by our occupational therapy team, and they are going to give you a hip kit. And that is what we have here. So let's talk about each piece of equipment. Everything that we talk about today is going to be given to you on the day of surgery, and it is yours to keep. Nothing has to be returned to us. This is all yours. So first off, what we do is we give you a grabber. This grabber is about 36 inches. I'm 5'6", so you can see I very easily can reach the bottom. Something gets dropped on the ground, I can pick it up. You have a rubberized tip. You have a little hook at the end, which is nice, especially if you're trying to do something like snag your pants, which obviously I can't do right now. There we go. And then you do have a magnet on the side. So if something is magnetic, you can snap it and bring it to you. I really like this because you can clip it to your walker or you can clip it on something next to you. I would recommend that you get an extra grabber. They have them at places like Harbor Freight, Walmart, obviously Amazon has everything. But a grabber would be beneficial not only with your recliner, in the bathroom, and in the bedroom. So, first thing you get is your grabber. Next off, we do give you a long-handled shoehorn, which is nice. The only thing with this is that you do have to be sitting down to use it. So when you're sitting in the chair, it can help you put your shoes on or off. But I like to think about how you can be a MacGyver with all of the equipment that we give you. The goal is really to increase your sense of independence. So if I were sitting in bed and I had my feet propped up, I can't bend forward to pull my covers up. I would keep my long-handled shoehorn next to my bed because I can use the hook to pull my covers up or a quilt, right? So that's great. Plus, right after surgery, when you're getting up and down, You should have your shoes on first thing in the morning. Do not be walking around in your bare feet. It's an increased risk for a fall. So, next thing on the list is your long-handled sponge. A lot of people don't understand why we give this. Think about when you're sitting in the shower. You need to be able to wash up without bending over. This is also great for after you shower. When you're done, wring it out really well and then use it to start drying yourself off. Added bonus, when it's time to wash your car, you can actually get on top. And then the last thing that we give you is this. I joke about if I had a 2-liter bottle of pop and a jump rope, I would have been a millionaire. This is your sock aid. Sometimes it's called a sock assist, a sock pull. The goal of this is to help you put your socks on by yourself. We all think it's nice when we have somebody that, can help us go get things, asking your significant other, but the time is going to come when you're going to want to be able to get up and do things on your own. So, with your fabulous footies that you will get here at Carteret in that lovely shade of gray or maybe hunter green, without breaking my hip precaution, this is how you put this on, okay? Take your sock or one of these, and you're going to put it over top. You want your toes to be flush, and you don't want to pull this all the way down. Now, you take it, toss it in front of you, extend your foot, and pull up. And that is how you can put your socks on. So absolutely, your hip kit is a great way to build that independence back and to get you more mobile after surgery. Now, your next hip precaution, and this is probably the one that makes people the most nervous, is what I'm doing right now. You cannot cross your legs after surgery. Whether it's this, even this. Now, some people already have difficulty with that. Me personally, this doesn't bother me. However, where I can feel my hip pain is when I cross my legs down here because it rotates out my hip. So, how do we get past this? Most of us do it subconsciously. I'm sure if you count during the video, I'm going to do it 100 times. Listen to your body. The most important thing after any kind of surgery, be it a belly surgery, a joint replacement, or any other kind of procedure, is to listen to what your body is telling you. If I were to have surgery on my right hip and I even remotely made the motion to pick my leg up to cross my leg, it's going to hurt. So listen to that, okay? Best piece of advice that we can give you. So don't worry so much about this. And as you start to progress through your recovery, your physical therapist and your surgeon are going to be the person to really let you expand and give you more leeway. Some patients will say, well, how long are my precautions for? At the absolute most, I've seen them be 3 months. But with that being said, everybody recovers differently. It doesn't matter if you're 85 or if you're 44. I have seen 85-year-olds running around the nurse's station doing great, and I've seen 40-year-olds on the struggle bus. So we look at you truly holistically to build your whole plan. So now we've talked about our 2 precautions. All right. The third one is, I like to affectionately call the bug swish. You see that awful water bug and you do this movement, right? Or you're trying to dance and boogie. This is what you're avoiding. Do not turn your hip out like this. The other thing is, I want you to think about shoes. Let's say you have a pair of sneakers. When you put your foot in, most of the time, don't you do this to get your heel in place? That's that movement that you're avoiding. So again, don't twist. And think about it too, you don't want to cross over left of center. So if I'm having my right hip done, I don't want it to cross over my body like this. I can actually feel that pain right here. So the best thing for you to do is at night, when you're able to get back into bed, put a pillow between your knees so that it keeps your hips stacked instead of twisted. Patients have often said, can I get into bed right away after surgery? It depends on how you feel. I recommend patients sit up in a recliner, mainly because it's more comfortable to get up and down from a seated position than it is to have to try to swing your legs over the bed, have a family member help you, and get up, especially if you have to go to the bathroom quickly at night. So just to review, let's go over those hip precautions again. Sitting in the chair, do not bend forward past 90 degrees. Don't cross your legs or your ankles. And then no twisting. Okay. So now we've talked about the most important thing. We've kept you safe. Let's continue to move along the process. So now that we know how you're going to move, let's talk about how you get up and down from the chair. Like we talked about before, when you're sitting in the chair, feet flat, shoulders over your hips, your nice neutral position. Most of us tend to have to get that momentum, right? Push yourself up. As you can see, I already broke my hip precautions and my center of gravity is off. That's going to give me an increased risk to fall after surgery. So this is how I want you to get up now. While you're sitting in the chair, it's a lot easier to get up if you're sitting on the edge. So let me turn my chair so you can see. All right. After a joint replacement, if I need to move forward, I can't bend forward. So what you do, lean back in your chair, your couch, wherever you're sitting, and scoot your hips forward like this. As you can see, now I'm on the edge and my center of gravity is over the edge of the chair. When you get up to move, you want your operative leg forward. And I'm going to turn my chair again so that you can see from this angle. So we're sitting on the edge. My operative foot is a little bit more forward than my other foot, okay? Maybe about 6 inches. Don't do this. Don't do this. Don't have it out at a funny angle. Literally just a little bit more in front than the other one. This leg is tucked underneath you a little bit because as you stand, your body weight shifts to your non-operative leg. And you always want to make sure you try to have a chair that has armrests because you're going to be getting a good upper body workout. So you're going to push up straight. And this is what's different. Most people aren't comfortable with that. So I want you to practice this movement at home after you're done with the video today. So let's start that back from the beginning. Sitting back in my chair, I'm going to lean back, scoot my hips forward till I'm at the edge. My operative leg is forward and my better leg is tucked. Hands on the armrest, push up straight. Okay? I want to show you what happens if you try to do that when you're sitting all the way back in the chair. If I'm here, my operative foot is forward and my better leg is tucked. When I try to stand, my center of gravity is off and I can't stand up as well. So that's why I encourage you to always sit towards the edge of the chair. Now, if you're like me, I have 2 German Shepherds and they sit on the sides of the couch and I'm in the middle. So I would really have to think about how do I get up and down, right? So look at the different areas that you sit at when you're in home. For example, our kitchen table and chairs, they don't have armrests. So I would have to think how I'm going to get up, how I'm going to move. The other thing, and not one of the more glamorous ones, is we really want to think about your toilets, okay? Not everybody has a handicap height toilet. Not everybody has the chair height toilet. So after a joint replacement, specifically a hip, you have to get yourself an elevated toilet seat. There's lots of different ones out there. One of the ones I like actually has armrests built into it. And the nice thing about that is it gives you that independence. Most of them are tension. You just put them on the toilet and then you can easily get up and down. Don't worry about have to go to a medical supply store. We are very blessed in Carteret County and surrounding areas that we have great communities, a lot of congregations, churches. They have the equipment sometimes there. A lot of people in our neighborhoods do a really good job of saying, oh, I had a joint replacement done 2 years ago. You can have the stuff, it's just sitting outside. We have a lot of thrift stores that are more than willing to actually give you the equipment with just a small donation. So there's lots of places to find things and you don't have to spend a lot of money. So definitely get yourself an elevated toilet seat. Let's think about what else are you going to need at home. One of the things I do strongly recommend for everybody is you have to have somewhere that you can sit down in the shower. You will be surprised at how quickly you get tired after a joint replacement. You might think I can take a quick 5-minute shower, and a minute into it, you will be a lot more tired than you realize. So have some place that you can sit. One of the things to look at is when you're sitting in a chair, you always want your knees lower than your hips. Now for my shorties, this is where you thrive because you tend to be down lower that way. For my gentlemen that are like 6'2" or 6'3", when they're sitting up like this, you're breaking a precaution. So now that we're sitting like this in the chair, what I want you to do is think about any other spot in your house that you might require something. The only other option I tell people is you need to have a grab bar in your shower. It's incredibly important to have something to hold on to when you are in there. So pay attention to that. All right, guys, so we've talked about our hip precautions. We've talked about how to stand up, practicing that in different areas of our home. Now I want you to meet your new best friend. This is Wilma. She is going to be with you 24/7, usually for the first week and a half to 2 weeks after surgery. You are meant to use a walker like this. As you can see, you want your walker to have the 2 wheels in the front. You can put tennis balls in the back if you prefer. This walker particularly is the one that the surgeons do like. The reason is that the Cadillacs that have the chair and the brakes on them, they're great. It's nice if you get tired and need to sit down. However, those are not as sturdy and they're not as stable. So Cadillac is fancy, but you want that good old Buick with you right here. So let's talk about the importance of this walker. Like I said, it's meant for balance and stability. It's not meant to hold your body weight, so that when you walk, and you can see this is set to my height, which is what physical therapy will do. If you're ever questioning if your walker is set to the right height, when you have your hands down at your side, the top of the walker should hit where your wrist is. So that's how you know that this one is where it should be. And as I walk, slow and steady, just like this, inside the walker, okay? I'm going to turn and come back this way so you can see. But as you can see, I'm looking up and I'm walking inside the walker. Think about this as your little cage of safety, all right? You don't want to push your walker out in front of you because as you can see by doing this, I broke my hip precautions because I'm leaning forward. And if I'm walking into my walker and my knee gives out, then I'm down on the ground, all right? If I'm walking with my walker where I'm supposed to and my knee gives out, I can catch myself quickly. So that's why your walker is meant for balance and for stability, okay? Like I said earlier, you're going to be using your walker for about the first week and a half to 2 weeks. It just depends. Physical therapy is the one that will progress you to a cane. We don't talk about the cane right now because that's going to be towards the end of your recovery process. This is what's really important. So let's put the walker and getting up and down together so that you can see how to do it. I'm going to go ahead and move our table out of the way and bring my chair. All right. So while we are sitting in the chair, you want your walker here. You do not want your walker all the way out in front of you because your natural inclination is to grab here or here. And guess what? Not only can you not get up that way, but you've already broke your hip precautions by bending too far forward. So bring your walker right here next to you. And let's practice what we did before. So lean back, scoot your hips to the edge. All right. My operative leg is going to go forward just that little bit. My other leg is going to be where I'm going to put my body weight. Grab your armrest and push up. And now you're in your walker, okay? There's different modifications that we can do with this. Talk to the physical therapist if you have some issues. I have a tear in my shoulder, so I would need to modify. But for the most part, that's how I want you to get up. So let's practice that movement again. Walker is right in front of me. Lean back in my chair. Scooch my hips to the front. Operative leg forward. Better leg tucked. And push up. All right, and now we're up and we can start walking. So we've walked around, we've done some activity. Always remember, you can overdo it after a joint replacement. It is much better to do short, frequent activity like get up, go to the bathroom, get yourself something to drink, and sit back down, than to go up and down the driveway 5 or 6 times. So now we're going back to our chair after we've walked. You need to very slowly turn a little bit at a time. This is not a sprint, this is a marathon, all right? Now, when you go back to the chair, you want to slowly walk back until you can feel it on the back of your legs. Your operative leg forward. You can do this 2 different ways. You can reach back with both hands if you're able to, and ease yourself down. If you can't do that, you can keep one hand on the walker, one hand on the chair, and ease yourself down that way. Again, if you need to do any modifications, the physical therapist will be more than willing to help with you. So, we've already talked about a good deal of things. We've talked about how to watch our hip precautions. We've talked about getting up and down. We've talked about the importance of the walker. Now let's talk about things at the house. We already discussed how important it is to have a shower chair, how important it is to have grab bars. Think about anything else that's going to make your life and your family's life easier as you're recovering from surgery. The biggest thing that we see patients do is leave trip hazards in place. So let's think about those trip hazards. Scatter rugs, power cords, those are all the typical things. But think outside the box. I told y'all earlier I have 2 German Shepherds. They tend to leave their bones, their tennis balls all over the place. Those are my trip hazards. So really take a good survey of your home, see what you need and what you don't need, because it's so much more convenient to be prepared than to have somebody have to go to the store at 3 o'clock in the morning. All right, so now we've talked about everything that we need for that. Let's fold up our walker and sit her over to the side. Now we're going to talk about things that you need to bring to the hospital with you. First and foremost, I want you to have loose, comfortable clothes, okay? Think about something that's not going to be tight. I do recommend our patients have elastic waistbands because you are going to have a bunch of swelling right here on the side. You don't want anything tight, especially a belt. Next, you want to have a t-shirt, something short sleeve. You're going to have an IV in place. Usually it's in your hand, might be in your arm somewhere else. This is the nurse's lifeline. So if we have to give you medication quickly, that's why that IV has to stay in place, okay? We take it out right before you leave the hospital. God knows if it's going to be 37 or 73. We do live in North Carolina, so pack accordingly. I do recommend everybody bring something like a hoodie or a jacket with them to keep them warm while they're here. And then one of the things that I really do not budge on is footwear. After a joint replacement, a shoe is super important. We talked a little bit earlier about not twisting and turning. So one of the things I recommend, and y'all can kind of see with the shoes that I have on today, is a pair of shoes that you can very easily slip your foot in and out of without bending over and having to have to tie. For example, I can just very conveniently set my foot in just like that, and I don't have to worry. It could be a pair of sneakers that are lace loosed. Some people wear deck shoes. It's whatever you are the most comfortable in. You have to have your heel and your toe covered. I know that we live at the beach. No flip-flops, no Crocs, okay? So now we've talked about our comfortable clothes. I want you to think about anything else that you might need to bring with you. If you are a patient that uses a CPAP machine at night, Bring your machine with your mask. We have water here. You don't need to bring that. The other thing is if you are a patient that takes diabetic injectable medication, make sure you let us know that also, and know when you're supposed to stop those medications if they asked you to. If you use an inhaler regularly, bring your inhaler with you also. Other than that, money, medicine, and jewelry, that can all stay at home. You don't have to have any of that while you're here in the hospital. If your surgeon wants you to have a water pill or any of your blood pressure medication, cholesterol, we have all of that here and we can give it to you. So now it's time. We know what we're going to wear. We've got the house set up. Let's get to the very last steps before surgery. This is your HIPAA. Now, I'm going to kind of come in so you can see it a little bit better. You should be getting a bottle of this. It might be in a clear container so you can see that it's pink. This is a super strong antibacterial cleaner. The goal prior to surgery is to get as much bacteria off of your skin as possible. That's what this does, all right? Most important thing to know when you use this, do not put it on your face or your private parts. You're gonna wash in the shower from the neck down. Let it sit on your skin for the prescribed amount of time that's on the bottle, and you're only gonna use half the bottle. Do this the night before. Before you go to bed, you're gonna put fresh sheets on your bed so you're climbing into something clean. And then it's the day of surgery. You're gonna wake up, take your second shower with the other half of your HIPAA solution. Shower from the neck down, avoiding again your face and your private parts. And then go ahead and get dressed. Really important to make sure that you have a go bag with you. I recommend that for everybody if you're going to be a same day surgery or if you're going to stay a day or two. Have your little creature comforts, and that's what's going to get you through. Other than that, you don't need to bring anything else. So we've showered, we're ready to go. You're coming in on the day of surgery. Okay. Now you're going to come in through the front entrance, which is our beautiful big glass rotunda. You'll stop at registration, check in, and after that, you go to the second floor, which is where our day surgery is. This is where they're going to get you all prepped and ready. So the nurses down there are going to put an IV in place. You're going to wipe off with some more bath wipes. We're going to swab the inside of your nose. We do multiple layers of infection prevention because the last thing you want is an infection after any surgery, especially a joint replacement. You are ready to go. Your surgeon is going to come in and speak with you, and the anesthesiologist is going to come in and speak with you. And then when that happens, it's time for you to go to the operating room. Your procedure takes about an hour and a half to 2 hours. That's the average. When that is done, the doctor is going to come out, tell your family that you did marvelous. And at that point, you get whisked away to the recovery room, and your family comes upstairs to the surgical unit, which is where we are today. All of our rooms on the surgical floor are private rooms, so you do not have to worry about having a roommate. You have your own bathroom, pull-out couch, recliner. At that point, when you come upstairs, this is when we want to make sure you start hitting your milestones. This is how we know that you're ready to discharge if you're going to go home the same day. And it's also how we track your progress. So first and most important is we got to get something on your belly, right? You probably haven't eaten since about 6, 7 o'clock the night before surgery. So our CNAs are really good about having crackers, maybe soda, some water on the table right next to your bed. So let's get a little something in your belly. The second thing is you're probably going to have to use the bathroom. So when you feel like you need to urinate, push your button. The nursing staff is going to come in with the walker, and we're going to help you to get up. And don't be nervous, because our goal is to get you out of bed in 4 hours of arrival back from the recovery room. This is what helps us to help you recover the best and to recover faster. So we get you up, we get you to the restroom. When you're done, we sit you in the recliner. At that point, physical therapy is usually walking around and they see that you're ready. So they're going to get you up and they're going to start working with you. They're going to set your walker to your height, and they're going to do some gentle activity. It's pretty much, let's see how you get up and down. Tell me if you have steps at your home. Are you in a 1-story or a 2-story? And you're just getting up and moving around the room. They may bring you out into the hallway for a little bit, depending on how you're feeling. So now that we've got something in your belly, you've used the restroom, and you've worked with physical therapy, the last thing, and the one that I feel is the most important to me and my team up here on the floor, is managing your pain. One, everybody's pain is different. I have chronic migraines, so if you give me a Tylenol, I know that's not going to work for me. So we truly, again, make this a holistic experience for our patients, because what works for one doesn't always work for another. So for me, our goal is that when you get home, all you have to worry about is rest, recovery, and good physical therapy. I don't want you or your family have to be scared about your pain management plan, because that's what we're going to do while you're here. And that's what we're going to talk about first. The first thing that we do when it comes to pain management is we talk about putting you on the right pain pill. Is it a narcotic? Most patients, yes. Could you just do Tylenol? You can. But what we do up here is we make sure that we start you low and we work our way up. And once we find the pain medication that works the best for you, we stop. Because there's no reason to hit you with a really hard medication when we know that one right about here works just as good. If the physician gave you some medication that they wanted you to take when you get home and you already know what that is, let us know, because we can try that medication for you while you're here. We also know that if that medication doesn't work, that's great, because we can get you on the right one. Call the doctor and say, hey, this kind of wasn't cutting it, but this is what works. All right. I had a patient in a room, for example. She was getting 10 milligrams of oxycodone, which is a really strong pain medication, and it wasn't helping. So what I did was I asked her if we can try something different, and I encouraged her to try a muscle relaxer and some Tylenol. When I went to check on her to reassess her pain, she was sawing logs, which was great, because as a nurse, I know that I did the right thing for her. When that patient woke up, she said to me, "What did you give me? Because that worked better than anything else." Case in point, just because it's strong doesn't mean it's the right medication. So I encourage everybody to try a muscle relaxer. Does it mean it's going to work for you? No. But if it does work, it's another tool in our arsenal to help manage pain. So we've got our narcotic pain medicine, we've got our muscle relaxer. The next thing is our surgeons use a long-acting injectable medication. What they'll do is after they do the replacement, they inject all around the soft tissue, okay? This medication is special because it actually slowly releases over a 3-day period. We know that the first 3 days after any surgery are always the worst. So if we can manage your pain, when that medication wears off, you already know what to take when you go home. So let's think it through. Right pain medicine, muscle relaxer, long-acting injectable. That injectable medication is not a block. You do still have pain, but it's dampened. So those are our tools in our pharmacy arsenal. Now, as a nurse, my goal is to really try to manage your pain with non-pharmacological methods, right? So that's where some more presents are going to go home with you. And let's talk about this guy first. This is your polar cube, okay? This is a fantastic piece of equipment. In the back, it uses an AC adapter that'll just plug into the wall. While you are here in the hospital, the staff is going to fill this up with ice and water. The pump is going to filter the water through the hose to the pad. When you're sitting in the chair, it's going to be right on your incision. And most people can truly sit like this and not have to worry about it slipping out of place. If you are not up and walking around, you are icing. I cannot stress that enough. Legs elevated, ice on your hip. Now, the thing that I love the most about this is that this is constant circulation of cold water, which means this pad can stay in place for an extended period of time, all right? You can put this on before you go to bed at night and let it just stay. I do recommend that when you get home, put this inside a pillowcase. That will help to protect the skin and any condensation that might be off of it. The other thing that I recommend for patients when they go home is think about how you can save yourself and your family some frustration. So, one of the tricks that we know is that people have said to take 8 16-ounce bottles of water. So you can see right here. Take the wrapper off if there is one. Inside of the Polar Cube, there's a fill line. We'll show you this while you're here. Take your frozen bottles of water out of the freezer. Put them inside of the Polar Cube. And the filter pump sits perfectly in the middle. And all you have to do is set this down and ice that joint. Okay? So again, if you are not up and walking, you are icing. So we've got our Polar Cube taken care of. The next thing that we're going to use are our jelly packs. Okay? I do send you home with these. These are fantastic specifically for when you go to your physical therapy appointments. And I'm going to tell you why. Before you leave the house, about 30 minutes to an hour before physical therapy, you have got to take some pain medication. This is really important because therapy is going to push you. You have to have medication in your body working so that you can do the exercises. Don't try to be a hero and not take it and say, I'll take it when I get home. It doesn't work, okay? We know that once pain gets really high up here, it's incredibly difficult to bring it down to a tolerable level. So I do send you home with this nifty little black pouch. There are 2 little spots. Take your freezer packs out of the freezer right before you leave. Slip them inside here. When you get in the car, put them on your hip. Okay? When you get done with physical therapy and you get back in the car, put it on your hip. When you get back in the house, switch back to the Polar Cube. That Polar Cube is constant circulation. This is like the bag of frozen peas. If this gets left in one spot for too long, it can cause a cold injury. So, only really use these when you're going to therapy, doctor's appointments, things like that. These packs will actually stay cold for a pretty long period of time, so you don't have to worry too much about that. So, the next thing that we give you, and this is specific, patients that have a spinal cord stimulator, pacemaker, bladder stimulator, anything that is implanted that is electrical, loop recorders don't count. Any electrical device that's implanted in you, we can't give you one of these. But if you don't have anything, we send you home with a TENS unit. If you have not used a TENS unit before, TENS stands for Transcutaneous Electrical Nerve Stimulator, which is why we say TENS. It's quite a mouthful. This particular unit, when you get it, it is already set, so you don't have to worry about adjusting this. And there is a 9-volt battery. I do recommend that you get another one because you're probably going to go through them fairly quickly. The unit is turned off until you start to feel pain. You are going to have 4 electrodes, just like when you had your EKG prior to surgery, respectively here, 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 and here. Okay? If you've never used a TENS unit before, it feels a little bit like a buzzing sensation. I do not want to walk in your room and see you twitching. That means that it's turned up a little bit too high. And if your family is not happy with you, do not let them touch this. So very slowly, when you tell me you're starting to have pain or one of the other nurses, we dial it in. The best way to dial this in is that think about how you turn up the volume in the car. You want to do it nice and slow. When you can feel that you have a buzzing sensation, we stop, and then we switch to the other side and turn it back on. When you can feel it on both sides, we let it be. You can use your TENS unit with your polar cube. You can use them independently. If you don't like the TENS unit, you don't have to use it. This is really meant to be a good method of pain management. It helps your body to produce endorphins, which are nature's pain management. All right. So we will go over this with you in detail more while you are here. So let's think about, how are we going to control your pain when you go home? First things first, narcotic pain medicine for most people. You're going to have a muscle relaxer if it works. You're also going to have that long-acting injectable medication. We're going to use your polar cube. We're going to use your gel packs, and we're going to use your TENS unit. So our goal for you is when you get home, you don't have to worry about anything. Your pain plan is set, and you know what you need to do to be comfortable. So you've hit all of your milestones. You decide that you're going to spend the night. And when you wake up in the morning, the staff is going to get you up about 5:30, 6 o'clock. At this point, we are going to get you ready to start your day. So the nurse is going to come in, and she's going to want to take a look at your incision. All right. So after you get dressed, she's going to have you either in the bed, or more than likely she's going to have you standing. She's going to take that big extra fluffy dressing that you have on the side off, and underneath, that is when you will see your bandage. Okay. This bandage is specific to our joint and spine patients. The one I'm showing you right here, it's a little bit bigger than the one for a hip. This is actually one for a knee, but the premise is the same. This very thick silicone heats up after it gets applied to your body, and it creates a super, super good seal. The back of this, it looks a little bit gray. That's because there's silver. Silver naturally helps to prevent bacteria from growing. So your bandage is probably going to be right about here, give or take. Okay. The nurse is going to take a peek at it. She's going to see if she needs to change it. Hopefully she won't, but if she does, she will. And then at that point, we send you home with an extra and a cleaner. Okay. Let's talk about the dressing. That surgical site dressing is special. It is actually made to stay in place for 10 to 14 days, which means if you don't have to touch it, you're not going to. Okay? So let's take a look at what we have up here so that you can see better. I have 3 examples, and this is more than likely what you'll see. So if we take a look at the first one, there's a little tiny bit of shadowing. That's light. All I want you to do is keep an eye on it. All right? Let's say you take a look at your dressing and you have a little bit more. We're gonna monitor that because that's a moderate amount of dressing. This is when you need to change it. Okay? This dressing is saturated from the top to the bottom, that entire area. This has to be changed. All right? Light, observe. Moderate, monitor. Saturated, change. That's why we give you the extra dressing and the cleaner. You'll take off the dressing, you'll clean it with the provided cleaner, and then you'll put the new one on. So we know what we're going to do about the dressing. We've got that taken care of. The extra dressing that I give to you, I want you to bring that to every follow-up appointment that you have with your surgeon, because the doctor may take your dressing off, look at it, and leave it open, or he might take a look at your incision and go, ugh, where's that dressing Stacy gave you? Put it on. Okay? Now, the nurse says your dressing looks great. She's given you some pain medicine. Enter the evil nursing assistant. Yes, I can say that because I was once an evil nursing assistant. And if y'all have not worn these bad boys before, you're going to wear them now. So these are your compression stockings. The goal of these, it's got multifacets, but after any kind of joint replacement orthopedic surgery, you are at an increased risk to have a blood clot, okay? Blood clot can lead to a stroke. Nobody wants to have a stroke. So your surgeon wants you to wear compression stockings for 6 weeks, 20 hours a day on both legs. Are they tight? Yes. Do some people think they're hot? Maybe. Are they uncomfortable? I think it's a matter of opinion. As a nurse, when I walk around for 12 hours on cement floors, I wear compression stockings and my legs feel great. The goal of this not only is to prevent a blood clot, but the compression actually helps your body absorb fluid better, and it helps to increase blood flow to the joint, which means you have to wear these to every physical therapy. Another trick with these, for the people that are going to be helping to take care of you, you do not put these in the dryer. I would probably wash them in the sink with a little bit of dish soap and then let them air dry. You can put them in the washing machine and that's fine. Just do not put them in the dryer. We measure you to make sure that you have the right size stockings. These stockings I pulled for myself and they're brand new, so I'm going to put them on and demonstrate that with a trick for you. I do send you home with 3 pair, so you'll definitely have plenty to work with. All right. You cannot put these stockings on by yourself because you cannot cross your legs. So you have to have somebody that loves you very much and that's going to be willing to help. So let me tell you my trick, okay? Get yourself some baby powder, cornstarch, anything like that you have at home. Please don't use flour. Flour doesn't work, okay? The other thing that you're going to want to do is you can either use the bag that the stockings come in, okay, which a lot of our nursing assistants do, or you can get yourself a plastic Ziploc bag, all right? I like a zippy bag specifically because it's thicker, but I do have people that have used a plastic grocery bag too. So whatever you have, whatever works. All right, so let's demonstrate. Now, again, I am crossing my leg right now so that I can show you this, but you cannot do this. Somebody has to put your stockings on you. So I would take the baby powder and put it all over my foot. And I can put it up my leg if I want to. It's not going to cause any problems. Okay. I'm going to take my plastic bag, and you want it to cover your foot, toe to heel. Now, for these stockings, and like I said, y'all, I opened up a fresh package, so these have not been put on anybody before. They have a blue square where the heel is. Once you get over the heel, it is smooth sailing. It's a lot easier than you think to put them on. So if I was going to put these stockings on a patient, I would grab it like this and slip it right on the foot. Then all your family member has to do is start to pull it up until you get right here. I didn't put forth much effort whatsoever to do that. And then they can wiggle that up your leg. Most of the time as a nurse, when I get here, I tell the patient, you got it the rest of the way from here. Using your muscles is also going to help you use your muscles when you're getting up and down. So let me show you how high these stockings actually come up. All right. Fabulous. I'm all out of fishnets, so you get white. Okay. So you've got your stocking on. One of the important things to take a peek at, do you see how it's nice and smooth? That's important to make sure that you don't get any creases because that could cause skin breakdown. So we've got our stockings. You've got this little hole. Take your foot out, grab the plastic bag, and pull it out. I cannot tell you how much easier this is than having to have to struggle to put them on without this or this. So again, you're going to put these stockings on both legs. After your nurse sees that you have your stockings on, they're going to bring you into this lovely room, which you can't see a lot of it, but this is your beautiful blue physical therapy room. And this is when we're going to do a lot of the activities that are in your binder. And we're also going to kind of work with you on different exercises to help you while you're recovering until your first outpatient or home physical therapy appointment. We're going to have you go up and down steps. We're going to talk to you about how to get in and out of the car. This is a really good time if there's other areas that you're trying to figure out how do I get into and how do I maneuver around, ask your questions then. And then after you do therapy, we're going to have you watch a discharge video. The video is going to be me and another nurse, and we're going to kind of hit the highlights of everything that we talked about today. The goal is really to have that be an educational piece for whoever is going to be helping to take care of you at home. Okay, so we have gone over everything. You have put your stockings on. The nurse is going to go through your paperwork, and you will get to go home. All right. Sometimes people will say to me, well, Stacy, when can I take a shower when I get home? All right, well, you can actually shower when you get home. That is why in your book, we tell you to get something like Press and Seal, okay? Does it have to be specifically Press and Seal? For the trick that I'm gonna show you, yes. If you have never used Press and Seal before, the fabulousness of it is that it is sticky underneath, okay? And once you have your dressing, there it is. Sorry, guys. I knew it was somewhere. We're going to pretend, okay? Once you have your dressing, you're going to tear off 3 sheets. One sheet is going to go down here. And you're just going to press it down, okay? Your next sheet, and obviously this is on your hip, but we're just demonstrating down here. Your next sheet is going to get layered right here. And then you're just going to press that down. And then your third sheet is going to go here. So you put these on just like you layer shingles. And as you can see, I've got a decent gap up here and a decent gap down here. And all I have to do is press it to my skin. I can get into the shower, wash up. This is what's great about this. After you're done, you can peel it down. If I have fragile skin and I bruise easy, it's not going to bruise me or tear my skin. It's not going to pull any hair, and it does not pull that bandage off. So every time you shower until the doctor says you don't need to, cover this up with Press and Seal. I am so happy that you were able to watch this video with me today. I really feel that it's important to have all of the tools necessary to help you to have a happy and safe recovery. Know that we at Carteret Healthcare are always here for you. There are going to be some phone numbers provided in your binder. I do want to reinforce one thing. If you are having problems with pain management, please do not call us here at the hospital. Call your surgeon's office. They are the ones that are going to be able to adjust your medication. If you are having a problem standing and we're able to prior, as in I stand up now and I have the most excruciating pain, that is something that you need to go to the emergency room for. If you are having shortness of breath, difficulty breathing, or increased chest pressure or pain, call the emergency squad. They are coming to pick you up. Or if your leg is hot and swollen, and there is a certain amount of warmth and swelling after surgery, that heat is going to feel like a 3rd-degree burn, and the swelling is going to be a lot more than you realize. So those are the big takeaways for when I want you to call the doctor's office or come to the emergency room. Otherwise, I wish you a happy and successful recovery. You will meet me again while you are here. Again, my name is Stacy Brock, and on behalf of all of Carteret Healthcare and my staff, I wish you a great and happy recovery. Thank you.